elements of so-called populational responsibility in healthcare, which is a key issue in order to tackle the development of artificial intelligence in the healthcare system. That's absolutely a key point for developing AI, for developing algorithms in the system, for developing robotics. Countries like Canada or the US are at the forefront of the development of populational responsibility, but thanks to pioneers like David and of course Antoine Malone, with whom I used to work with for the French Hospital Federation, there is now an avenue open for populational responsibility in healthcare. You asked me this morning to deal with the issue of ethical stakes involved with the development of AI within the framework of the healthcare system. I will try to share a brief presentation. I just need to be authorized to do so, since I see that the sharing of the screen is not available for me. That's not a problem. I'm sure that the techniques will operate in a nutshell, and that's done just great for the techniques. Thank you so much. Okay, here we go. Are you able to see my screen? I have to say that this morning I'm intervening in front of you with the backup of the French Societal Society for Digital Healthcare, and David asked me to deal with the issue of ethics within the development of artificial intelligence in healthcare. I have links of interest to acknowledge. First one is the fact that I'm healthcare manager for Jouve. Jouve is a French IT company developing algorithms in the system, and of course, and also I'm the co-founder of Ethik-IA, which is an academic and citizen initiative which promoted the very idea of human warranty of AI, and I will try to explain to you what it is through a quite pragmatic example, which has been dealt with the French Union of Dental Doctors, Union Française pour la Santé Bucco-Dentaire, UFSBD, and we highlighted the first human warranty compliance pattern in France and Europe. So what is the actual issue is, as you all may know, there is a strong development of AI within a healthcare system, with, of course, an accelerating factor because of these pandemics. We have very drastic movements, both at the medical side of the system, and of course also, which is not as well known as the first effect, from the point of view of the back office of the system. That is what we operate with Jouve, for instance. There are ethical stakes involved with that. I have been the co-chairman for the preparation of the French bioethics law re-examination process with Claude Kirchner, who is the president of the Council of Ethics for the French National Institute for Artificial Intelligence, under the scrutiny of the French National Council of Ethics. In the presentation, you will find the references of the reports, and more specifically, a reference is made to the French National Council for Ethics 129 opinion, which is dedicated to digital and AI, and which has been the basics for the bioethics law examination. And there is a strong process toward the recognition of human warranty, human oversight of AI, which is now opposable in France, but it has also been recognized both at the European and at the international level, thanks to the World Health Organization. So as I earlier on stated, to understand what are the actual stakes of human warranty, the best way to do so is to put the focus on a very practical example, which is the development of AI at the scale of the dental office. As it is occurring in the hospitals, dental practice is at the conjunction of three fields of application of the AI. Diagnostic AI. You all know that the most operational technique is imaging recognition, with a large number of use cases applying in radiology, dermatology, or oncology. It's the same process for dental caring, with a large field of access to medical algorithms, mostly with imaging recognition processes. Second field of application is the fact that, just like hospitals, dental offices are a place to collect data and to operate prevention and oral care patterns. There is here a strong connection with the very notion of populational responsibility. You would collect data and then operate prevention, public health incentives in order to much more orient the French pattern towards prevention, which is one of our most acute weaknesses, as you all know. And the third field of development is back office AI, which has to do with supplies and logistic flows. Here again, it's the same pattern for hospitals, because you will find AI applying to onboarding of patients and applying to logistic fields, just like in biology or in pharmacies. What is the framework of human warranty compliance? It's the framework of the former Article 11 of the bioethics project bill. It has turned into an opposable law, and it's not the Article 17 of the bioethics bill, with actually two new standards. The first one is the implementation of a prior information of the patient on the use of AI in this care. And the second one is a deployment of a human supervision of the AI solution in real life in condition of traceability. The 2 points are quite crucial, because, as you see, this human warranty notion applies both at the scale of the patient and at the scale of professionals. What are the ethic risks which are involved in that? Actually, you've got two kinds of risks that the human warranty is made to tackle. The first one is what we call delegation of decision or delegation of consent. This delegation risks, you will understand it very easily, is the fact that if you're a professional, you're able to have a proposition from the AI applying to a large number of solutions with 99% degree of proposition. And the very practical issue is the fact that if a doctor has to deal with such an alternative, really keep a certain degree of freedom of decision in that respect. And this risk of delegation of decision also applies to patients. It's what we call delegation of consent. And that is very practical either, is the fact that when confronted with a proposition of caring which has been processed under the supervision of an AI tool, will the patient still be able to express fully his consent? So to deal with that, we promoted with Ethik-IA since and with the backup of the French Digital Healthcare Society, this notion of human warranty. What is the basic idea of that? Is that human oversight, human supervision, quite be useful to regulate these ethical stakes. But the very issue is to deal with what we call positive regulation. Is the fact that the first ethical risk would be to block innovation of AI in the system, because if you block the development of AI, you will prevent healthcare systems from getting the enhancement of quality caring for patients on the one hand, and also the enhancement of efficiency of the healthcare system on the other hand. So we need to be open-minded towards AI, but in the meantime, to regulate the healthcare process and to regulate the ethical stakes which are involved. The first ethical stakes, as I earlier on mentioned, the delegation risk of delegation of decision and the risk of delegation of consent. The second kind of ethical risk embarked with AI is what we call distension between individual and collective interests. As you know, algorithms on the wall, but also algorithms in healthcare operate as mathematics, but also very collectively oriented tools. It's based on, it operates decision and proposes decision on the basis of the large number of rules. And in some cases, as we all experienced within the framework of a crisis, of a pandemic, there is a tension between the interest of the individual and the interest of we as collective bodies. And that is what we have to regulate, since when we will collectively experience the potential of evolutions of positive evolutions of the systems linked to AI, there is a risk that we might oversee these negative side effects for individuals or a group or for a group of individuals. So that's the very fundament of this idea of human warranty. You, I think, checked out this European Commission draft AI regulation, which has been released on the last month of April. Is the European AI bill, which is quite based on the framework of the GDPR. It's a future legal standard, which is bound to be opposable within a period of time between 18 months or 2 years. The bill will be enacted during the French presidency of the European Union, which will start the last month, next month of January. I just put this slide forward in order to help you keep in your mind what is the basic framework of this bill, which tackles the issue of AI as a whole, but there is a specific set of regulations applying to human oversights and AI. What is interesting to point out is the fact that a link is made with the CE marking, because as we proposed, this very positive regulation tool is made to operate under this framework of CE marking. There is a strong connection between this new legal body, the new ethical body of regulation, and the industrial stakes which are embarked in the system. So you need to get your human oversight process and your human oversight certification if you want to get a CE marking, and you don't need to operate 2 times the same procedure, which is quite interesting for either professionals and industrial. So let's focus on this Article 14, which is specifically dedicated to human oversight. And you see what are the basic principles underlying this principle is the fact that there is a need for artificial intelligence solutions in healthcare and in all other sectors. That's a key point, since this body of legislation is bound to be implemented in all the sectors of application of AI. And the very idea is the fact that there is a need for this AI tool to be supervised by human, both at the stage of the conception of algorithms and at the stage of their effective implementation in real life. In this Article 14, you will find this idea of information of the final user, that is to say, information of patients in healthcare, and you will see you get a more specifically described definition of what is the appropriate information of the final users. It is made to help the patient, help the final user of AI to fully understand the capabilities and limitations of the AI system and to be able to monitor the operation so that risks of unexpected anomalies, malfunctions, and performance can be detected. Quite an operational and pragmatic approach of monitoring of AI. It is also made to be aware of the risks associated with decision support AI and to correctly interpret the results of high-risk AI. One of the key points of this legislation and one of the key points of ethical stakes of AI as a whole is the fact that you need to somehow appraise the level of risks embarked by AI in order to properly monitor the positive regulation side. In the classification, which is linked to this new European body of legislation, AI healthcare systems are all classified within the high risk category. And in this high risk category of AI tools, you will get the need to have a much more fully integrated human oversight system. And you will find in this Article 14 the two sides of the human warranty: information of users of the AI solution on the one hand, and human supervision of AI from its design phase, the so-called ethics by design, and in the well-known logic of continuous quality improvement, also the application of human oversight at the stage of its use in real life. So let's focus on the example I described. In a nutshell, you will find here a describing of the Auralien solutions, which has been devised by a French startup, Dental Monitoring, which turned last month to be our 20th unicorn. And this solution operates in hospitals, but also at home. And the paramedics will operate the solution with a smartphone, and the paramedics will shoot a video, and in this video there will be a detection of the risks, of the dental risks, and this video imaging recognition AI will be confronted to a natural language interpretation of the medical file and to data collected through questions asked to the patient, just like questions asked on the degree of assessment of the dental pain experienced by the patient. We were asked to devise the scheme of the human warranty procedure, and this first pilot scheme for human warranty supervision of AI has been underlined by the French National Council for IT ethics. What we devised under the operating authority of the French Union of Dental Doctors which acted as an independent body external counterpart, is the fact that we operated a regular supervision of ethics stakes, and this human warranty college, gathering both healthcare professionals and patients representatives. It's very important to get the two sides of the aspect. This human warranty colleges operates a review of files already dealt with by AI every 3 months. We review 30 files every 3 months with a second opinion expressed by human supervisors who are dental doctors, who do not have any links of interest with the IT producer of AI, and the files are exported in a secure environment able to host health data. In this IT environment, the files are virginized. That is to say, we erase the traces of intervention of AI in order to place the dental surgeon's reviewers in the context of expressing their own opinion on the medical side of this file. And at the end of the process, you will get an assessment of the differences of opinion between AI and human reviewer in order to explain these differences and to propose corrective steps. And these corrective steps, we are at the third human warranty college applying to this dental monitoring solution. These corrective steps apply both for doctors, dental doctors, and to the producer of the algorithms. For instance, of corrective steps which have been taken, we operated a recalibration of the integration of the age criteria of patients within the algorithms framework in order to have a much more reactive algorithms for elderly people. And second corrective step taken, we appraised the level of dental pain assessment experienced by patients. So you, as you, I think, will agree with, I will try to stop the sharing of my screen. That is quite a practical way to operate things. In hospitals, all the professionals are very accustomed to continuous quality assessment processes. We worked with the French Digital Healthcare Society closely, both with the French National Healthcare Authority, la HAS, and with representatives of producers of AI, SNITEM, LELEM, which are the representatives of digital AI medical devices, and also of digital AI medical devices embarked within the framework of medicines. And we now get a common ground for human warranty, which is shared by both Ministry of Health, which will release in the coming weeks a large methodology guidance, which will explain very practically how to operate this new human warranty compliance. As I mentioned earlier on, and I will, this will be my conclusion, the WHO endorsed also this human warranty notion. It released, and I will of course send you all the links to get to the report. It released a guidance book for AI ethical regulation last June, and this guidance book describes very specifically these human oversight proceedings and recommends to all the WHO members, that is to say at a global scale, to apply the two sides of human warranty: information of patient and monitoring through the involvement of healthcare professionals and patients, both at the stage of the designing of the AI solution and at the stage of its implementation in real life. Last mention, the American FDA just also endorsed these human warranty principles, but only from the opposable side at the stage of implementation in real life. And the FDA, when in the opinion it expressed at the 2020 CES of Las Vegas, just before the burst of the pandemics, declared that it will suspend its FDA approval if the human warranty principle is not applied at the stage of implementation in real life. So as a conclusion, this idea, which was worked with professional representative of patients, and thank you once again for all the discussion we had together. Thank you once again to David Laplanche and his backing of this notion and its deployment effectively with respect of the populational responsibility operating scheme. We now have a common ground and common methodologies to try to operate the ethical stakes involved by AI. But as you probably understood, with the first notion that the first pressing ethical need for AI in healthcare is to develop these tools within the French and the European framework in order to avoid the importation in France or in Europe of AI tools which could have been previously devised in less requiring ethical environment. I hope you got it, and I was clear despite this video connection. And thank you for your attention. Thank you so much. Maybe you have some questions?
It's very challenging, and now we switch to the question session. If someone has a question, whether in presence or maybe also by video. No question.
Just a word, if there is no question or complementary comment. Ethics is also at stake at the stage of economic accessibility to the solution. We might devise an effective regulatory scheme, which is, I sincerely believe, is not the case. We will still have huge ethical obstacles to overcome if we prove unable to guarantee a proper economic access to these solutions for everyone. Because there is an obvious risk, which is even strengthened within this the aftermath of the pandemics, is the fact that our own social security now experiences very harsh economic difficulties, and has so far proved unable to reimburse at a large scale these AI tools. So there is a need to devise an appropriate economic scheme, either funded by social security or by equitable social coverage operators. Otherwise, the access to these tools will be reserved, practically speaking, to the citizens who are able to afford it. And there is a risk of an enlargement of inequalities in the system parallelly to the spreading of these innovations.
Okay, thank you for this clarification. We have a question here in the room.
Okay, thank you for your very interesting presentation. Christophe Sauvé, Université de Lorraine. One of the main concerns of the AI developers about ethics deals with the point of the ability to stop the AI at any time, a point that you pointed out in your presentation. I wanted to know what's your personal opinion about this, about this ability to stop the AI at any time.
That's a very, very good question. Quite a tricky one, because as you maybe noticed, this notion of what we could call a full stop clause is not embarked within the framework of the Article 17 of the French bioethics law. Actually, we did not propose that, but still, it has been integrated in the Article 14 of the European Bill. This bill is still at the stage of the parliamentarian debates. It will be fully enacted most probably during the French European Union presidency. For the moment, this full stop clause is still within the bill, but I have to speak frankly, I have doubts on the fact that it could be technically speaking be operated. I prefer a quite continuous human oversight procedure with a regular assessment of risks and a human oversight process which is adapted to the level of risks embarked by AI. I prefer that kind of scheme to maybe quite irreal, unrealistic full stop clause. And I won't linger on technical aspects, but if you think of AI tools globally implemented with cloud solutions of hosting operated by GAFAM or American GAFAM or Chinese BATX, I'm quite dubious on the effectiveness of such a full stop clause.
Okay, thank you. Also, I have a question. So, as a researcher in AI, so I have a naive question that okay, we are conscious about the importance of ethics in AI, but sometimes our problem is to say, okay, it's important, but if we add constraints in our research, could this slow down our research and slow down our progress? Because okay, the framework is in Europe at the European level, but other countries also continue to work, to continue to progress on these techniques in AI, and sometimes maybe so there's a difference, and we can be surpassed and outperformed in our research by other countries who will not respect these ethics constraints. So what is your opinion about that?
That's once again a key point. I really invite you to take a close look to the 129 opinion officially expressed by the French National Council of Ethics, because quite paradoxically enough, it's a very new reading of our so-called principe de précaution, which has been introduced into the Constitution, and the human oversight principle operates on the opposite side, because it is made to nurture the development of AI, even at early stages, but to monitor innovation all along the way, both at the stage of the conception of the tool and at the stage of its implementation of real life. Because the French Council of Ethics highlighted the very first risk embarked by AI in a world in which the pandemics opened up very large access to health tools, even conceived outside of Europe. So if we are not able to help our researchers like you to effectively develop tools in France or in Europe, we will give incentive to professionals and patients to try to get access to tools conceived either in the US or in China in less requiring ethical environment. So we need to go on the two sides of the issue, developing of AI firstly, and regulating all along the way the ethical stakes. Quite a drastic change. You might acknowledge if you think to previously devised French or European regulatory schemes.
Okay, thank you for your answer. Is there any other questions in the room? Okay, so we thank again our speaker.
Thank you so much. I was delighted to be with you this morning, and of course, I'm eager to go on with you on discussion on this, of course, major topic.
Sure. Okay, sure. Thank you very much.
Thank you so much.